Welcome to your guide for A-Level Psychology Specialty Subject Health Psychology, Papers 3 and 4, now with focused revision tips for Paper 4. Let's break down the key studies and how to use them for exam success. First up, Savage and Armstrong, 1990, compared directive versus patient-centered doctor consultation styles. They found patients were more satisfied with a directive approach, even if they didn't fully understand the details. Paper 3 tip. Use this study to discuss medical communication, consultation styles, and patient perception. Paper 4 tip. It's perfect for debating the ethics of paternalistic medicine. Should doctors be directive or should patients lead? Also, evaluate effectiveness versus autonomy in healthcare. Next, Yoakley and Glenwick, 1984, tested 4 ways to increase childhood immunizations: general info, personalized letters, monetary incentives, and phone calls with follow-up. The phone call plus follow-up was most effective. Paper 3 tip. This is a strong example of quasi-experimental design and community health intervention. Paper 4 tip. Debate which interventions are ethically appropriate when influencing parental choices, and consider the practicality and scalability of these interventions in public health. Brudvik et al., 2016, examined how doctors, parents, and children rate children's pain. Adults often underestimated pain, especially in younger children. Paper 3 tip. Use this for observational accuracy and self-report discrepancies. Paper 4 tip. Discuss the importance of empathy in diagnosis, training medical professionals, and the ethical consequences of misjudging pain. Also, consider concerns about validity in clinical settings. Bridge et al., 1988, tested relaxation and guided imagery as complementary therapy for breast cancer patients. Results showed reduced stress and improved coping. Paper 3 tip. This is a great example of psychological intervention using mixed methods. Paper 4 tip. Debate the scientific credibility of complementary therapies. Is it placebo or genuinely therapeutic? Also discuss patient autonomy and holistic care. Shoshani and Steinmetz, 2014, ran a school-based positive psychology program, gratitude, resilience, optimism, and found improved well-being, less anxiety, and better behavior. Paper 3 tip. Use this for school-based interventions and positive psychology. Paper 4 tip. Debate whether schools should prioritize mental health alongside academics, and consider the sustainability and long-term effects of such programs. Quick tips for Paper 3. Understand intervention designs, and evaluate validity, reliability, and sample populations. For Paper 4, focus on debates like, are complementary therapies valid? Should medicine prioritize cost or care? Is it ethical to nudge people toward healthier behavior? You've got this. Now that you're familiar with the 5 key studies, it's time to, really sharpen your analytical skills. Comparing and contrasting studies is absolutely crucial for evaluating their strengths, weaknesses, and overall contributions to the field. So, here's a simple framework to help you out. First, think about methodology. Compare the research methods used in each study. Did they use experiments, surveys, or observations? And what were the strengths and limitations of each approach? Next, consider the sample. Were the participants representative of the general population, or was there a sampling bias? How might the sample characteristics have influenced the findings? Then, have a look at real-world relevance. Evaluate the ecological validity of each study. Can the findings actually be generalized to real-world settings, or are they kind of limited by artificial laboratory conditions? Don't forget ethical considerations. Analyze the ethical implications of each study. Were participants treated fairly, and were there any potential risks or benefits involved? Finally, look at contrasting perspectives. Highlight any conflicting findings or interpretations across studies, and think about what might explain these discrepancies. By systematically comparing and contrasting studies, you'll gain a deeper understanding of their nuances and limitations, which will really allow you to form well-supported arguments in your exam answers. Here are some handy tips to help you ace those A-level psychology exams. First, know your studies. Make sure you have a solid understanding of the aims, methods, findings, and implications of each of the 5 key studies. Practice, practice, practice. The more you practice applying your knowledge and writing exam-style answers, the more confident you'll become. Use your time wisely. Allocate your time effectively during the exam, ensuring you have enough time to answer all questions thoroughly. Read questions carefully, pay close attention to the wording of each question, and make sure you understand what's being asked before you start writing. Structure your answers. Use the P structure to organize your thoughts and present your arguments clearly and concisely. Stay calm and focused. Take deep breaths, manage your time effectively, and avoid getting bogged down by challenging questions. Remember, preparation is key. By following these tips and putting in the effort, you'll be well on your way to achieving A-level psychology success. Congratulations on making it to the end of this guide. You've now gained valuable insights into the fascinating world of health psychology and equipped yourself with, honestly, all the tools and strategies you need to excel in your A-level psychology exams. Remember, the key to success is consistent effort and a genuine curiosity to understand the complexities of human behavior. Embrace the challenge, review the material regularly, practice your exam technique, and don't be afraid to ask questions. You've got this!